Hello, my name is Nicole Wall. I'm a licensed insurance broker and owner of Holton Insurance. The Medicare Scholar Program is designed to give educational content about different Medicare topics throughout the year. Today, we will be learning about Original Medicare versus Medicare Advantage. Here is the agenda for this presentation. We will be covering choices, enrollment, coverage, network, billing, extras, prescription coverage, and 2024 updates. Beneficiaries have a choice when it comes to their coverage. They can choose to have Original Medicare, which includes Part A, Part B, and Part D coverage, or they can choose to enroll in a Medicare Advantage plan, which combines Part A, Part B, and Part D into one package. There are numerous differences between these two options, including enrollment, coverage, network billing, prescription coverage, and extra benefits. Enrolling in Original Medicare happens during three distinct times: the Initial Enrollment Period, IEP, the General Enrollment Period, GEP, and a Special Election Period, or SEP. The IEP is centered around the beneficiary's 65th birthday month and begins 3 months prior and ends 3 months after. If the beneficiary chooses not to enroll during their IEP, they have the opportunity to enroll during the GEP, which starts each January 1st and runs through March 31st, with benefits beginning on the first of the following month you enroll. For example, if you enroll in February, your benefits will begin on March 1st. These days, many individuals are choosing to work beyond age 65 and may delay enrolling into Medicare if they are covered by group insurance based on their or their spouse's current employment. They have the ability to enroll any time they are covered by the group plan, and up to 8 months after they lose employment or their group coverage, whichever happens first. Like Original Medicare, enrolling into a Medicare Advantage plan can happen during specific time frames, including the Initial Enrollment Period, IEP, Annual Enrollment Period, AEP, Open Enrollment Period, OEP, and numerous Special Election Periods, SEP. The IEP is based on the month the client receives both A and B entitlement, generally their 65th birthday month, and begins 3 months prior and ends 3 months after. Each year, all beneficiaries have the ability to enroll into, change, and cancel their Medicare Advantage coverage during the AEP, which starts on October 15th and runs through December 7th, with any change going into effect January 1st. Individuals already on a Medicare Advantage plan can utilize the OEP to make a one-time change to their coverage. From January 1st through March 31st, they can change their Medicare Advantage coverage, disenroll, and go back to Original Medicare and enroll into a standalone Part D plan if they choose. Outside of the IEP, AEP, and OEP, beneficiaries may have the ability to enroll in, change, or cancel their Medicare Advantage coverage utilizing a Special Enrollment Period, or SEP. The most common SEPs are loss of group coverage, qualifying for Medicaid or extra help, and change in residence. Medicare Part A covers a beneficiary if they are to receive Medicare-approved care at a facility, including inpatient hospitalizations, skilled nursing facilities, and home health care. For inpatient hospitalizations, the client must satisfy the Part A deductible before Medicare will cover the rest of their care for the first 60 days. If they are in the hospital beyond 60 days, they will pay a per-day copay up to 90 days. Beyond 90 days, the client is utilizing their lifetime reserve days, of which only 60 are available, while the client is enrolled in Part A. All charges beyond the lifetime reserve days are the responsibility of the beneficiary. Part B coverage is a beneficiary's outpatient Medicare-approved charges, including physician visits, outpatient tests and imaging, outpatient rehabilitation, durable medical equipment, and some medications administered at a doctor's office or outpatient facility, like chemotherapy and infusions. Each year, beneficiaries must satisfy a Part B deductible. Then they receive 80% coverage for services, leaving them to pay the remaining 20%. There is no maximum on the 20% a beneficiary may pay in any given year. Medicare Advantage plans work very differently and utilize a series of copays, which are set dollar amount for specific services, and coinsurances, which are percentages they must pay for a specific service, which can be found in each plan's summary of benefits. Each Medicare Advantage plan has their own list of copays and coinsurances, so benefits can vary widely between available plans. Medicare Advantage plans have a maximum out-of-pocket, called MOOP, which makes them unique compared to all other parts of Medicare. All the plan's copays and coinsurances apply towards the MOOP, giving the beneficiary an absolute limit on their annual spending for all covered services. Prescription drug costs and non-covered benefits do not apply towards the MOOP. Beneficiaries with Original Medicare can see any doctor or facility that participate with Medicare. As of 2020, 93% of all doctors and over 5,300 hospitals in the country participate. Medicare Advantage beneficiaries must utilize a network of providers for coverage based on the type of plan they are enrolled in. There are Health Maintenance Organizations, or HMO. Beneficiaries here must utilize in-network providers to receive coverage for services, except in emergency or urgent care situations. There are also Preferred Provider Organizations, or PPO plans. Beneficiaries can utilize the plan's network of providers and facilities to pay the lowest co-pays or coinsurances for covered services. They are able to go outside of the network, but will pay a higher out-of-pocket cost, and they must still see a provider or facility that participates in the Medicare program. Physicians that accept Medicare are broken into two categories, either participating or non-participating. A participating provider accepts Medicare assignment, meaning they agree that Medicare's limit for each service is payment in full. These providers bill Medicare directly for services, and they are paid directly from Medicare. A non-participating provider accepts Medicare clients, but they do not agree to accept Medicare's limit for services. They are allowed to bill up to 15% higher than Medicare's approved amount. These providers will bill Medicare directly, but Medicare will pay the beneficiary, and it's the beneficiary's responsibility to pay the provider. There are also excluded providers that do not participate and are unable to bill Medicare for any services. It is the beneficiary's responsibility to cover the cost of services received from excluded providers, as Medicare will not reimburse for any expenses. Medicare Advantage plans take the place of Original Medicare when it comes to billing. Providers bill the plan directly for services, and the plan will pay them back directly, leaving the client to pay any applicable copays or coinsurances for covered services. If there is an issue with billing, both the provider and the client can reach out to the plan for assistance. Original Medicare provides few extras, but those that are provided are essential to help a beneficiary stay healthy and active. Upon enrolling in Part B of Medicare, each beneficiary qualifies to receive a full physical within 12 months of joining that will be paid 100%. Afterwards, Medicare will pay for an annual wellness visit, which is a list of questions that are reviewed with the beneficiary and covers a wide range of topics, including physical, emotional, and mental health, medication adherence, concerns, and so on. Original Medicare also covers a wide range of preventative services to help beneficiaries detect any illnesses or diseases early, including bone mass measurements, cardiovascular disease screenings, cancer screenings, colonoscopies, diabetes screenings, mammograms, and many others. Medicare Advantage plans include all of the extras from Original Medicare, plus other benefits which make the plans very attractive to some beneficiaries. These extra benefits may include, and benefits will vary by plan, dental, vision, hearing, fitness, transportation, chiropractic, acupuncture, annual physical, post-discharge meals, telemedicine, over-the-counter supplies, and many more. Beneficiaries can refer to their plan's summary of benefits for a full list of extra benefits. Beginning January 1st of 2006, Medicare beneficiaries could enroll in Part D of Medicare to help cover the cost of their outpatient prescription drugs. Those on original Medicare would sign up for a standalone Part D plan that's provided by a private insurance company. Many Medicare Advantage plans include Part D coverage built into the plan, so the client receives their health and prescription benefits from one company. These Medicare Advantage prescription drug plans are referred to as MAPDs. Clients with a PFFS Medicare Advantage plan has the option to purchase a standalone Part D plan. Here are a couple recent changes. As of the 2024 plan year, Part D plans will cover 100% of the cost of covered drugs when beneficiaries reach the $8,000 out-of-pocket threshold. Another one is individuals at or below 150% of the federal poverty level will qualify for 100% premium subsidy through the Extra Help program. Thank you for watching. If you have any questions, please feel free to contact us. If you would like to have a free Medicare Scholar presentation at your local senior center, VFW, lodge, or other activity group, let us know and we would love to set something up with you. Lastly, keep a lookout for our next presentation.